So as we look at healthcare spending, the question is, well, why is it important? Why do people care? Right? Why is it such a hotly debated topic? And the reason is that it's money. It's expensive. And so if we look here, this is the out-of-pocket spending, and it looks at young, middle-aged, and older. We can see that, when you're younger, about 4% of your overall spending is for healthcare. But as you get older, you end up spending a larger and larger portion of your budget on healthcare. And for elderly, 13%, that's very high. They're paying a large portion of their healthcare. Now, this is as of 2010, and it's as healthcare costs have risen, especially in recent years, those percentages have been going up. So a couple things we're going to look at. We're going to look at healthcare spending in the United States. We're going to look at the sources of financing and the providers. All right, so we're going to look at overall spending. We're going to look at the financing, where does the money come from, and the use, where does it go to. So the first thing we need to do is, when we talk about spending, we need to look at just a basic two-party transaction. And with the transaction, how it works is you go to, for example, the supermarket, and you give them money, and they give you goods and services. All right, so they give you your fruit, your ice cream, your vegetables, whatever it is. And so in this regular two-party transaction, we have money going from the consumers to the firms, going from the consumers to Whole Foods. In exchange for that money, they get goods and services for it. Now, those firms, let me bring this up here, our firms here, yes, they're getting the money. Yes, they're providing the goods and services, but where do those goods and services come from? They don't just get that fruit and snap their fingers and it's there, and at the same time they don't just you don't just go there and everything is just automatically put there. So in order for those firms to get those goods and services to you, right, they need help. Now, firms are just entities. Now, you have owners of the firms, but the firms are just entities. Right? It's not a firm is not a person. So in order for you to get those goods and services from that firm, you need to have firms, other firms or individuals, who allow you to produce it and to give it to the goods to you. And so, for example, you go to Best Buy to buy an iPad. And when you go there, Best Buy didn't just snap their fingers and it was there. They needed people to produce it, the iPads. They needed people to ship it. They needed people to stock it. They needed people to operate the the cash register so that you can buy it. So this is all stuff. This is all inputs that is used or factory production to actually get this into your hands. And so these firms and individuals, they provide services to the firm. In exchange, they get money. Now this is called derived. There's derived demand here. And what derived demand is, it's when demand for one good is derived for or depends on demand for another. So, for example, the demand for skis. All right, so you go to the mountains, you go up to the Poconos or Vermont to go skiing. You need skis to do that. It's a little bit difficult to do it without them. Well, the demand for skis is derived demand. What is it derived from? It is derived from the demand to actually go skiing. And so if there's no demand to go skiing, there's not going to be any demand for skis. Right, so if nobody wants to go skiing, who's going to want to buy skis? And at the same time, if demand to go skiing goes up, there's going to be more demand for skis. Right? Now, the important thing to derived demand is that it's a one-way street. It's not substitutes. So if the demand for skis goes up, the demand for to go skiing isn't going to go up as well. So it's a one for one, or it's a one way. In this case, the demand for these services is derived from the demand for the products. And so if there is no demand for iPads, there will be no demand for the people to produce and sell it. Now, we've gone and we've talked about consumers. They give money to firms in exchange for goods and services. Those firms get services to produce it from individuals or other firms in exchange for money. But where do those people come from? They come from individuals, you, me. The people who buy goods are also the ones that help to make goods. Now, this is on a large scale. So if you look at individuals as a whole, right, all individuals as consumers, well, they need money somehow. And they get that money as they go to work for firms, or they work as independent contractors, and they give services to other firms. And so these services that these firms get up here, well, they get them from the same individuals that are buyers. And so the individuals that are buyers, they provide their labor, their land, their capital, their entrepreneurship. And in exchange for that, the firms give them money. Okay? And then that money comes up here, and it's going back to the firms. And so this is the idea of the circular flow of funds. People get money, they spend it. Now again, this is on a large scale, and it's not a one-for-one. You may spend more money than you bring in, use credit, or vice versa. But over the long run, it should even out. Now, it's also clearly not a equitable distribution of the money. So let's look at healthcare spending in the United States as of 2015. And if you're looking at your book, these numbers are a little more updated, and this is the more recent. So in 2015, this breaks down the uses, all right, where is the money going to, and the sources. Now, here's an important thing when we talk about sources of healthcare spending. The important thing is that when we talk about that, we are talking about it at the point of service. And what that means is it's when you go to the doctor, when you go to the hospital. Right? So you might say, all right, well, Medicare, Medicaid, other government, private insurance, well, they're not just, they're not paying for it, all right? I'm paying them, and then they're paying for it. So when we talk about self-pay or out-of-pocket, we're just talking about at point of service. Now, these numbers are per capita. And you can see that when it comes to the uses of the funds, where does that healthcare money go? A lot of it's going to hospitals, physicians, and medicine. So 30, 50, 62, 63% of all healthcare spending goes towards hospitals, physicians, medicine. Now, there's also a lot of other in there. Now, here's the biggest thing here. $9,990. That is the amount, on average, how much each person in the country pays for their healthcare. $9,990. Now, you may say to yourself, well, wait a second, I pay way more than that between premiums and out-of-pocket expenses, and that's true, and we will get to that. So as far as the sources of funds, all right, a lot of it's coming from the government. So 21% Medicare, 18% Medicaid, 4% other government. All right, so it's 20, 39, 43% from the government. 35% is coming from private insurance, 11% from other sources, and then the self-pay. All right, this is another big thing here, 11%. Right. That's all we are paying out of pocket for our medical care, 11%. Now, the other thing we can look at here, this is just kind of a more graphical representation of the previous, the uses and the sources of funds are exactly equal. All money that goes somewhere, goes to a provider, must come from somewhere. And this goes back to the idea of the circular funds which we were talking about. All right, so all money that's going to hospitals, physicians, dental, all right, has to come from where? So it's either being come from self-pay or other, private insurance, other government, so forth. Okay. So that's the circular flow that we're talking about. And here's something that's really important, and this is the idea of out of pocket. All right, the self-pay. Now the state is not completely updated, but you can get the point. So what we're seeing is, if we look at down here at self-pay versus third parties, you can see that it's been a complete reversal. So in 1929, we were paying 81% out of pocket. Today, we're paying 11%. And this is as of 2012, but as of 2015, that's still roughly the same amount. Third parties? Well, third parties, your insurance, the government, charity, it used to pay 19%. Now, 89%. So what we are seeing is we are seeing a massive shift to where we are paying percentage-wise less and less out of pocket. Right? Percentage. So what does that mean? You might say, well, wait a second, I'm still paying a lot when I go to the doctor. Well, what has happened is, if we look up at the health spending part, we are seeing that the per capita went from $330 in 1929 to $1,697 in 1970 to $8,900 in 2012 to almost roughly $10,000 as of 2015. Okay, and that's clearly, that has continued to go up since then. And as a percentage of GDP, which is where all of our money is going, we went from 3.5% to 7.2% to 17.9%, and that's even higher now. And so if we look at this shows, so we have two lines here. We have our one which shows the health expenditure per capita, and the other is the percentage of out of pocket. And so we're seeing over time our healthcare spending per capita has been going up while our out of pocket has been going down, again, to 11% in 2015. And so we are spending more and more. And we'll talk about this when we talk about moral hazard, but this is a serious problem, because as we are less responsible for our visits, we're more likely to use it, to go when we may not necessarily need to, because we're not paying that much, all right, out of pocket at least.